All right. My name is Annette Iglarsh. I'm retired. I'm a former physical therapist and academic. I've been in the academic sphere for about 20 years and a therapist for 45 years. And I'm a member of SMP, which is the Senior Medicare Patrol. And you could see the topics that I'm presenting. Senior Medicare Patrol is a part of Elder Services. We're going to go over fraud, errors, and abuse. You can see the 3 items below that it's very important: protect, detect, and report. We'll talk about your journal, and then we'll make sure that you receive them, and I'll share some other resources with you. So I'd like to start. SMP is a federal program, and we have 50 states and 40 territories. You can see them below. And every area, every location, every state, every
Territory.
other, pardon?
Territory.
Territory, thank you, has a SMP program. I should say that there is also a SHINE program, and I understand that you have 2 individuals at your facility that have a SHINE person. Am I correct? Okay, so I'll go quickly over the Medicare items in the second half, but in the first half, I will focus just on SMP. And you can see here is essentially we want to make you an engaged healthcare consumer. And this will help you when you're dealing with Medicare, Medicaid beneficiaries, family members, life partners, caregivers, and professionals. We all have to be more active. We are all responsible for our own health care. And what you could do is you could share some of this information, certainly your health journal, and with the other individuals in your life, so that they could see that you're more organized. And when you ask them questions, you have a document to refer to. So that's my goal, and hopefully you'll feel that way when we finish. Next, please. Fraud is someone is producing something, a service or an object, when they know they're doing it, it's intentional, and it's because they want to get money from you. And what happens is they'll say it's for free, if it's a service or if it's an item. And so of course it sounds great, but it really isn't, because you will probably pay a copay and then Medicare won't pay for it. And so you'll be responsible. The other thing is, go back a slide, please.
All right.
The other thing is that basically won't stop sending you just one item. They're very nice, they're very friendly, they'll say they want to help you, and they want to send you braces. This is the one thing I'm talking about now. I'll mention it in detail later. And so what happens is you get a slew of whatever you agreed to. And we'll talk about that towards the end of the program. It's hard to say this because it's a real problem, but 60 to 90 billion with a B is lost to Medicare fraud annually. That's 10% of the Medicare budget. So when people identify that we're having a problem or they're concerned about the budget, 10% of it is to fraud. Next. The 5 major fraud schemes, and you may have been affected by 1 or 2 of them, services are simply not rendered. And they bill Medicare in your name with your numbers to tell them that you received something, and in some cases, Medicare will pay for it. And so that is a problem with abusing your Medicare benefit. They may suggest, and this could be a practitioner that you're seeing, that you take another type of drug, because it may be that they have an incentive from the producer of that drug to use that drug instead of the one they initially asked you to take. Upcoding is when they charge you for something at a higher level, perhaps more time that they spent with you. Unbundling is, there are two sets of charges in Medicare payment. One is a bundle where everything is under one charge. Unbundling is they charge for each item that they did to the individual or did for the individual. Upcoding is cheaper usually than unbundling. The other thing is they have a false front provider office. Now, it could be very much on the phone so that an individual calls you, identifies who they are representing, a name, which probably isn't theirs, and they say, your physician or a healthcare provider asked me to call you to find out if you can benefit from our braces because they thought it would be helpful. One scam. The next thing is identity theft. And that is simply when somebody gets your information, they bill for the service that they didn't render to Medicare, and Medicare uses your number, your name, and sends them money. So because of that, we are defrauding or having a problem in using the funds for Medicare that the individual that charged you was not able or should not have ordered. There are also COVID-19 related scams, and we'll talk about that as we go through the different types. Next. Okay, so these are errors and frauds and abuse. Errors are simply mistakes. We all make mistakes. So that is why we ask you initially to contact the person that billed you. They have a whole staff that they have that are there to bill you and to answer your questions. So you're not bothering anyone. And you need to identify if this bill is correct because you don't remember having it, or it's a duplicate, or it seems unnecessary. Lab tests may have been not been performed. They may have been performed unnecessarily. So they may have charged you for the test, but not done the test. X-rays may not be necessary. Let me stop there. X-rays may not be necessary, and they could even do the wrong part, the wrong body part. Very often with a leg or an arm, they can look at the wrong part. It may not be your bill. It may have been coded to another person. It may be that the surgery wasn't necessary. It may be that the surgery was more elaborate than you needed or was overused. And the big thing that we'll talk about is telehealth, because that's a really important service that's done in our current pandemic situation so that you could gain health care virtually. Next. Home care is something that is really looked at very, very carefully because it is not as well controlled as it is when it's provided by a hospital or a service that goes into your home. And so home care is something that they have to go through. The person has to be homebound and need the skilled services. If you just have a transportation problem, you need to identify how you can be transported. You may be billed for skilled services that are not provided or are unnecessary. And so you will be left holding the cost for that bill. You may be charged for more visits or for services that you didn't get. And that's something that very often is a mistake, but if it's something they did intentionally, that is fraud. The other thing is you might not have gotten the quality of care that you deserve and that you're paying for. And so you're getting a inferior service or no service at all, yet Medicare is paying for it. Next. There are unintentional incidences that would be an error. They may do practices and procedures that are not consistent with medical practice. I was a physical therapist, and if a patient was an accident victim from an auto, they all got the same prescription. There's no way that everybody could have the same injury. So it may be inconsistent with sound medical, business, or billing or fiscal practices. You may be paying for services that you don't meet the professional recognized standards of care, or it could be unnecessary. So you'll know that you got the treatment by the bill, but you didn't get the level of treatment that you should have gotten. So these are abuse items using the system and committing the abuse and error of billing. Next. Durable medical equipment is another area that is problematic because the middle slide and the middle picture and the third picture deal with people with braces. And these are commonly given to individuals where it was not required, it was not ordered, and you will not be covered for. Plus, as I said before, they just won't give you one. They'll give you one a month, or they'll say, do you have any pains elsewhere? Oh, we have a brace for that. So it's important that you not take this offer of, quote, free, unquote, braces that your doctor didn't order. Another scam is a wheelchair that they may ask you questions about, oh, do you have problems getting along? Do you have problems when you're shopping? Do you feel you don't go out anymore because you're unsure of how you're walking? And they'll say, we could send you a wheelchair. And it sounds great. The problem is you cannot get another wheelchair for 5 years. So when you really need it, you might not have the type of wheelchair you need. And one type that they're really good on asking you if you want is an electrical one. It's spiffy. And they'll tell you that you could get the standard wheelchair and it will be replaced down the road with an electric wheelchair, but it won't. So as a result, you get penalized for taking a piece of equipment from people that shouldn't have been sending it to you and you didn't order, and you're out of a wheelchair for 5 years, which is problematic. You'd have to pay for it. Next. There is another scam going around in that they'll come to your door or they'll call you and they'll say, you know, wouldn't it be great if you could see how your drugs are helping your body to see if you're feeling better? Or that you could find out if you have a genetic or a hereditary disease. And oh yes, there are fake swabs being taken for the COVID virus. So who wouldn't want a COVID test in these days? Don't do it. Don't report it. Don't follow up with phone calls. You need to call Massachusetts Senior Medicare Patrol, and the phone number is there, 1-800-892-0890. It's important that when you get connected on the phone, when someone calls you that you didn't call, you should be suspicious and probably hang up. If somebody comes to your door, and they're very nice usually, what happens is they will try to get into your house or apartment. This is very dangerous because you will be exposed or unprotected from having somebody taking advantage of you, convincing you need something, or refuse to leave unless you buy something. So it's really important that that door is very, very important. It is your safety. I had a person listening to this talk who said, well, I didn't let them into my apartment but I have a terrace in the front of my apartment by the door. So we had a conversation on the terrace. Your terrace, if it's exposed to the public, is part of the area that you shouldn't be using inside your door. And make sure that when somebody does come in for any reason, like a home health nurse, they identify themselves and let you see their identification in the viewing scope that you have on your doors. I hope you do. But those are ways that you could save yourself from these two types of scams that I have presented. Next. Next, okay. The census, which has ended, was and may still be in some communities a false scam. You have to make sure that anyone that knocks on your door has a census badge. They have to be identified. And quite frankly, it is done. It is finished in Massachusetts, and nobody should come to your door to have you open it and give them information about the census. Next. Okay, if anyone calls and offers you anything for free, chances are it's not. So it's important that you hang up. They will do everything to keep you on the phone. Abruptly hang up. Just get off that phone, because while they occupy you, they could wear you down. They're experts. If you get postcards, or you see deceptive TV ads, and we certainly know that Joe Namath, when he tells you about their insurance, he's not from that insurance company. He's a paid representative. And these ads are awful because they convince you that they will help you. I mentioned the phone calls. Medicare rarely surveys you. Used to say never, but there are sometimes an annual survey. And so you have to make sure that it's truly from Medicare. You can call them and ask. Next. Never give anyone your unique Medicare ID, or for that matter, the Social Security number. They are yours. Treat them like you do your ATM or your credit cards. Medicare and Social Security will not call you. In fact, they will send you a snail mail envelope and message saying, we would like to call you at on such and such a day at such and such a time. And then they truly call you at that time. And believe it or not, they're great. Very friendly, help answer your questions, but they will never call you. So if we look at who's using snail mail, Medicare sure is, and it's for your security. Next slide. Okay, so this is a new one, and that's why it's on the top of the list, and that is the Economic Stimulus Check Alert. Someone may call you and say, have you received the stimulus check? Have you received what you deserved? Have you received the extra money that you can get? Chances are they are not from Medicare. It's a scam, and they're just trying to get your information because they'll take your name and your number to help you get that stimulus check. You have to call the numbers that are listed for Medicare. Carolyn, do you know who you call if there's a stimulus check alert?
You call the IRS.
IRS. And believe it or not, they're very helpful too. Next one, please. This is a little confusing. An ambulance will only be covered if that is medically necessary, which means that an ambulance is the only safe way that you could get to a medical service or a pharmacy. The patient must need the service, and the Medicare will then cover it. If you are transported, you need to be transported by an official or a certified Medicare ambulance. This is a certification. The confusing part is there's another type of transportation that is not covered, and that is chair cars. And there are companies that are not covered by Medicare that will say, oh, well, you don't need an ambulance. We'll be happy to transport you. Some people have used Uber or any of the services that are reputable. But it is important that you only take an ambulance when medically necessary. And you could ask the people that come and try to convince you to use the form of transportation. Next. Okay, that's the first part. Any questions about what we talked about, what I mentioned? It's a lot of stuff, but your facility, Sherry, is going to have available for you this slideshow, and you will be getting the the personal medical journals that you need to record all this information. Maybe you have a question after we finish Medicare. Okay, next slide, please. This is what's referred to as the alphabet of Medicare. Most of you know it. I'm going to go over it now because it's that important to know the differences. Medicare A is inpatient, skilled, hospice care, home care, and bona fide homebound beneficiaries. When you first get Social Security, they will offer you A as part of your Social Security. So you know what it covers. Everybody usually has A when they get Social Security.
You mean Medicare, Annette?
I'm sorry, Medicare. Everyone gets that. The ones that you have to pay for is B. And B costs different amounts, whether or not you get B from Medicare or you get a supplemental program or a gap program from a medical insurance company or a hospital. And you will get inundated with information and ads from people that are trying to convince you that they could help you get these services at a low cost. And you have to do your research. Medicare Advantage, which is C, is usually done through HMOs and PPOs. And those are most often done through insurance carriers. You can be a member, say, of Cooley Dickinson or the MGH. Hospitals in your area have a network, and you may be able to get Medicare Advantage through them. Prescription drugs are D, and these have different levels depending on the drug, and it's usually related to cost. And so the prescription drugs and the first level of drugs is usually covered if you have a prescription from a pharmacist or a pharmaceutical delivery entity. Medicare Gap is a supplement to A and B.
Medicare plans are a supplement for people on Medicare and B that help cover co-payments and deductibles. But we always remind people at this juncture, Annette, that questions about which Medicare you should be on, you should be seeing your Shine counselor, and you see your Shine counselor once a year.
And you get a book from Medicare that's new every year with new information that will give you something that you could refer to. It's comprehensive, but it's written relatively easy to read. Okay, sorry about that. Next. These are the things you can do to protect yourself. You must be able to be the person that prevents other people from using your medical services or billing for them that you don't need or haven't been prescribed. And you have to protect yourself or somebody that is a caregiver, friend, or significant other that helps you with these bills, helps you figure them out. You need to detect. Detection usually means you have to investigate. You have to call your physician and ask them the question about what you were billed for. So be careful that you just don't protect it, but when you get something, make sure you know what it is and that it's covered. The next thing people don't always do, and we'll talk a little bit about that, but you also have to report it. You could report it to SMP, you could report it to Shine, you could report it to Health Services. It's important that you document it and report it to an individual. We have an individual at our service that will work with you to investigate how and why you feel that this was inappropriate, and will follow up and see if it was appropriate or inappropriate billing. So you have a friend, a person who are in our office with a number of our volunteers will help you identify and report it. Next. Remember I said you have to protect Medicare, Medicaid, Mass Health, Social Security, and credit cards. It is necessary that you only take those cards when you go to the doctor, a clinic, or a hospital, and for pharmacy purchase. Most of us have a small wallet or a pack of cards that we take with us when we leave the house. This should be separate, and only take it when you go to these 3 places or categories of places that I listed for you. Next. Okay, there is something, and I'm not going to have Caroline go back, about your Medicare card. Make sure that when the person behind the glass says, I need to take a picture of your Medicare card, that you see them do it. That they're not making a copy and keeping it for themselves so they have all your Medicare information. This is rare, but you wouldn't believe that this happens as well. So be sure that you're seeing where your Medicare card is being copied and where the copy is being put. And most importantly, you get your card back. Next.
You want to do this be engaged?
Oh, so sorry. The Medicare healthcare, the personal healthcare journal, you can log your visits, you could log your tests, your procedures, plan of care, and medications. Some of this you have to fill in. So you have to fill in when your next appointment is, who's the appointment with, how you reach that office to verify an appointment or to let them know you're going to be late. They usually ask you to do that, but you can log your visit to the doctor. And as you do this for all of your doctors, you'll have a log of when you went to what doctor when, if this doctor you're visiting asks you questions. List your diagnostic testing, the date, and what was the outcome, briefly. Procedures. Did they do a certain type of injection? Did they give you a certain type of procedure, like help with you ranging the motion of your ankle? But all of these procedures should be documented. You don't have to go into detail, but you have to know what you wrote down. Care plans, you may have that from the doctor or the medical practitioner that you're working with. You usually have to ask to see it so that you can write it down. The other thing is medications, and it's important that you identify all of the medications. This is clearly something that you need to do. All the medications you're taking and the amount and how often. I've been known to just line up my bottles and I take a picture on my phone, and so I have all the information there. But you can certainly list your medications. I think the next thing is the most important. What do you want to ask the healthcare providers? It's important that you ask the questions so that when you leave and get into the car, you don't go, I didn't ask them this. Probably the most important thing you wanted to ask them. So it's important that you write down your questions and you identify any concerns that you may have. Think of it this way. What do you want to know, and what would a significant other, family member, or friend want to know about this visit? And make sure you write it down and write down the answers, because we all know we have times when we're listening to someone and don't remember it as well as we would like to. So it's important you write it down. This is how you get in touch with us. It's a call or a text, depending on what you do. And here's the phone number, 978-802-0268. Or you can send an email to Carolyn Cole, who's the woman.
That's me. That's me.
She's over there. She's moving the slides for me. And there is her email. And certainly use that.
And I'm happy to send you a personal healthcare journal. This is something we do provide for free. That's a legitimate free service that doesn't require your Medicare number. So we'll send you a personal healthcare journal. And if you'd like a couple or a few to give to a friend or to a spouse or whatever, just let me know. I'm happy to send them to you.
I have some of the people that I talk to that get them for their adult children. So they can learn to do this for themselves, and certainly as they get older as well. But, please use that service. Okay. There is a CARE Act. CARE represents care, advise, record, and enable. And we're very fortunate here in Massachusetts that this law requires that you are provided or your caregiver related to the caregiver's role, so that when you go into the hospital, no matter how much you feel that you can hear everything or that you could understand everything, it's important that you have a caregiver that will be able to remember, ask questions when you're hospitalized. Right now, it's even more important because they may be contacting that person virtually or by the phone because hospital visitation is limited. So it's important that you have an individual that you can help you with your medical care. I can tell you from experience, I'm a relatively smart person with a medical background. I don't remember anything on intake, because you're so concerned about what's wrong and being admitted into a hospital. So that's why you need a family caregiver. They will also be notified directly by the hospital if you are discharged to another facility or you are sent home. The terrible stories that we heard a while ago, many years ago, of being pushed out the door, and then you need to have somebody will pick you up. Those days are gone. You need to have a discharge plan. It has to be written down as to how and where you're going. The facility must also give you instructions and tell you or explain to you or have you try out what they needed you to do. And this includes those items such as medication, injections, wound care, transfers, and these are things that the family caregiver may perform at home. It's not this was way back when I first started to be a therapist. I had a doctor come to me who was very proud. His patient, who he was discharging, could get on the commode, the toilet, by themselves. He did not check if they could get off the commode, which we know is more difficult, and was shocked when I told him. So fortunately, Medicare is better. Medical care is better, and people on the nursing staff will be checking things out to make sure that you're performing in the safest way when you're sent home. Next. Okay, here is your health journal. It's going to look a little bit different in the future, but for the rest of this year, this is what it's going to look like. And it's for you to write down before you go all the visits, diagnostic, and the rest of the list is there. Also, you could write down when the appointment is. Later, put it into your date book or onto your phone, but at least have it when you're given the appointment. We talked about questions, and you will get better at asking questions as time goes on. You want to keep your medical statements from Medicare at least 2 years. It's important that you look at it every month. It's important so that you can check to see what you were charged for and what you received. And you have to compare those to your favorite journal so that before you pay, you're able to check off which ones were actually given or done. Carry the journal when traveling and make sure in the journal you have an updated list of medications. If you've ever been in the situation where you've traveled and you go into a doctor or a hospital, most of the time we become blank and we forget everything. And it's so important that the doctor has your medical conditions, what's happening now, who's your practitioner, and an updated list of medications. That is why it's important you bring your journal with you. Below there, in purple, is the Medicare, mymedicare.gov, and that will give you a comprehensive overview, a place to ask questions, so that you could have any of your questions answered by somebody who is trained and understands the Medicare guidelines. Next. There are, unfortunately, some times when there are things that should never happen to you. These are things that are not intentional. They may be an accident, or they are incorrect, or it may be that it happens and it wasn't expected, such as a foreign object that's left in from a surgery. You get an air emboli after you've had open surgery. They hopefully do not, but it is possible as to the type of blood you will receive. And you should be warned about pressure ulcers and about changing your positions. And that doesn't mean that you can't change your position safely when you're at home and when you're in the hospital. Now, there are traumas that can happen anywhere, but they also happen in the hospital. And that would be fractured bones, dislocating a joint, hurting your head, crushing a hand, burning, or electrical shock. So these are the things you have to be careful about. And if it doesn't look right, and you want them to check something or make sure that you're stable, or have them repeat what extremity they're treating, or you must tell them if any of these things happen to you, because you want the best possible care.
And we also want to mention, Annette, that Medicare never pays if this happens to you in a hospital. Medicare won't pay and the consumer doesn't pay.
Right. And it doesn't make sense, but because you're being covered by Medicare, but the hospital has to pay. Now, I mentioned your Medicare summary notice, and this is a copy of the summary notice. I'm not going to go through it in detail, but if you go to the area that's boxed off, you will see a chart right here that says Was the service approved? How much was the provider charged? How much did Medicare approve? How much Medicare paid? And what you were billed. It's generally 80% of 80% is what they pay. So you will get 20% of the bill that you have to pay. And it will explain with notes as identified with the letters after that box that's highlighted, why these charges were written as they are. If you want to question this payment, you must have this with you when you speak to Medicare or to SMP or to Shine, because it will reveal a lot of information that you need to have in order to guide you appropriately. Next. You can do an appeal if you have found or are concerned that there was a non-payment of Medicare. And this does happen. There are mistakes, and it could be because somebody's not being fraudulent. It could just be the way a billing person fills this out is that they hit keystrokes on a computer. And sometimes they hit the wrong keystroke. It's important that you sign the back of the Medicare summary notice and return it to them within 180 days. So it's something that should not be put on top of a pile, but it should be put somewhere that you will address it quickly. KeyPro is an organization that will listen to your appeals as well. It's another source. And I believe that that is on our website, and it may also be in the journal. I'm not sure. What do you think, Caroline? How do they reach KeyPro?
It'll be in the healthcare journal, and it's actually also on the MSN.
Gotcha. Okay. So you do have help, but you have to take advantage of it. Next. You also have to report it. If you don't report it, they're going to do it again to someone else. And so this is the order that you need to report. Call the provider, and they'll generally put you through to billing, but there is no reason why you can't speak to your practitioner or his nurse practitioner or her nurse practitioner or physician's assistant. You need to find out from someone at the facility to make sure that this was not a mistake and it could be a scam. Here are the other two bullets on how to call to report it to Medicare or the Senior Medicare Patrol, Attorney General, other state offices, and an important number is the Elder Consumer Hotline. I also should tell you that we're in a very lucky state. We have a wonderful Attorney General who's doing a lot of work trying to identify and put individuals in jail who are committing the scams. She has linked together several states on the East Coast, and they're all working together, and they've been extremely successful as to getting these people to essentially be arrested for what they've done. It's not unusual for us to see a bill of, I don't know, 20,000 that someplace charge a number of individuals. But the major way they'd know about it, that the attorney would know about it, Attorney General, is that you call them. And if you call Elder Consumer Service, they will record it. These are the reasons why you don't want to why you don't report. You don't want to bother the doctor. They find the MSN, the medical report, EOB are confusing, and they don't know who to ask. You should know who to ask. The other thing is that you may be part of a community by race, religion, country of origin, sexual orientation, that has little or no support, and they are uncomfortable asking for help. And the thing is that sometimes people feel that they're the only one, and they don't ask for help. Think of it in terms of, I'm not the only one, and I'm helping other people by reporting it. The new Medicare cards came out last year, and it should not have your Social Security number. They found that it was an easy way for people to steal your number and get Medicare illegally. So you only have a special number for Medicare and a card for Social Security. Okay. Oh, and the cards are free. That's the other thing. Okay. I'm going to highlight some things. Don't carry a Medicare card unless you're going to a medical appointment or pharmacy. Never provide your Medicare number over the phone. Record your medical events in your personal journal. Review all your bills for accuracy before paying. It's amazing, especially when some of these fraudulent individuals call and are not very pleasant and tell you you have to pay the bills. You need to know these are accurate bills. If you suspect errors, fraud, or abuse, tell someone. It's important. Now, I have a time that I could give you for questions like we did at the halfway point. Does anyone have any questions? Anybody? Carolyn, could you think of something that you need to emphasize or point to in the discussion that may be helpful for the audience?
No, but I would just say that the slide that's on the screen now gives our phone number. You've got my direct dial number for getting a healthcare journal, or I'm happy to take questions myself. And I put it into the chat, my phone number into the chat. And then our main number for our Lawrence office is 800-892-0890. And if you have any questions that come up after we get off this presentation, we're happy to take them. It's not a problem. We're there all the time. That's what we're here for.
Definitely.
Thank you, Caroline and Annette. There was a lot of information there, and I know a lot of details, and I'm happy to say that since we've recorded the program, it will be available. Walpole Media will convert it to a YouTube video, and I'll include it in my email, and it will also be on cable later on in the future. And with that, I can put in my emails that I think many of you are getting the phone numbers and that you provided, so that you can get your personal health care journal, that you know who to call to report any suspected abuse or fraud that you might see. And any other phone numbers that, Annette, you think might be helpful. We can include that in a little box, so it'd be very handy for you.
And keep it a place that you will know, that you will remember. I think we're all, we're common about putting it in the place to find it again, and we find that we forget where we put it. So make sure that you put it in a place that's easy for you to find and accessible.
I love the idea of the healthcare journal. I think it's really a great way that people can be take a much more active approach in protecting themselves and really know what you're having done to yourself and what you're being billed for, which is great.
Right.
As a healthcare practitioner, an educated consumer, you is a very important part of your medical care. The more you have to tell them about what you've done or what happened to you, the better the care is that you will receive. I can't highlight that more emphatically. Okay.
Thank you again. So if no one else has any other questions, we can thank you and let you go.
Thank you.
Thanks, everybody.
Thanks so much.
And thank you for your
Bye.
patience with me getting online. Take
I
care,
had
everybody.
trouble too today, so thank
Stay
you.
well, everyone.
You
Take care.
too.
Bye-bye.
Bye.